Chikungunya virus. Chikungunya virus is a vector-borne disease that is transmitted by mosquitoes and commonly causes fever, joint pain, headache, muscle pain, joint swelling, and rashes. Typically found in Africa, Southeast Asia, and Oceania, Chikungunya virus has globally spread, with 45 countries identifying cases and more than 1.7 million suspected cases worldwide. The virus transmits from human to human through females of the Aedes aegypti and Aedes albopictus species of mosquitoes. While outbreaks have been mostly localized to warm and tropical climates, the Aedes albopictus has spread into more temperate regions, spreading the disease to these areas. An outbreak in a temperate region of Italy highlighted the need for preparedness and emerging infections. 205 cases occurred between July 4th and September 27, 2007. Primarily elderly adults over the age of 60 were most affected, with cases overall being spread most equally among males and females. When investigating this outbreak, it would be necessary to first identify resources necessary to begin the investigation, starting with medical and public health officials, as well as material resources. An outbreak research team, with cooperation from medical and public health offices, will lead the investigation. Establishing the existence of an outbreak by conducting testing and confirming the diagnosis will then lead to moving forward with the investigation. Identifying potential cases will initially start with reports from local medical offices as they encounter patients with established chikungunya symptoms. Reports will be routed to the investigation team for confirmation. Once cases have been confirmed, identifying individuals with close contact with the infected individual and then moving outward will systematically lead to discovering more cases, moving back to the initial case or patient 0. Once all cases have been identified, the investigation team should work to identify and establish control and prevention methods. This will be necessary to stopping the progression of the outbreak and helping to prevent future outbreaks. Some methods to prevent future outbreaks would be to reduce the amount of mosquito breeding grounds near human habitation, as well as encouraging the use of mosquito control methods for individuals who are in close proximity to these areas, like mosquito nets and insect repellent. These are most common practices found in areas that are also experiencing infection of dengue fever. The findings of the investigation team will then be communicated to the proper government agencies as well as public health officials. Once they have been reported to these individuals and agencies, communication will be made available to the public in order to inform them of steps that they can take to prevent outbreaks in the future. By enacting these policies and procedures and working with government agencies to establish additional policies and procedures, future outbreaks will be limited. This will also create maintenance and maintain surveillance procedures that will allow government agencies, public health officials, and medical officials to move quickly should another outbreak occur. Thank you.